Hey, welcome! It's Ashley with Demystifying Your Health. Today we're going to be talking about allergies. If you're like most people, you either have them or you know of somebody who does. An allergy occurs when your body responds to a foreign substance, such as pollen, bee venom, pet dander, or even food, in a way that most people's bodies don't. Typically, when your body senses a foreign substance, it triggers your immune system to produce antibodies. This is awesome when you're fighting off an infection, because this helps your body recover. It's not so great when this occurs to ordinary substances. Depending on how your body responds, the reaction can be mild or severe. For most people with mild symptoms, they'll have itchy, watery eyes, runny or stuffy nose, and sneezing. A lot of people experience this every spring when it's pollen season. Some people have more severe reactions, usually the result of food or medications. Typically, these people will have swelling to their tongue, face, and throat, shortness of breath, wheezing, chest tightness, and hives all over their body. The most severe type of allergic reaction is anaphylaxis. This is life-threatening and needs to be treated by emergency personnel. Typically, these individuals will have nausea, vomiting, severe shortness of breath, a rapid heart rate, a low blood pressure, and can even lose consciousness. Treatment depends on your reaction level. If you have mild allergies, such as those who experience discomfort during pollen season, there are over-the-counter medications that you can take to relieve symptoms. These come in many forms, such as pills, nasal sprays, or even eye drops. For those with more severe reactions, you're going to need prescription-strength medication. Another option for those who have severe reactions is immunotherapy. This involves a series of injections of allergen extracts to be given over a period of few years. For those who experience anaphylaxis, they will need to have an or epinephrine pen with them at all times and use that if they are exposed to their allergen. It's important to note that if you use your EpiPen, you should still go to the emergency room because the medicine wears off quickly, and when it does, you can have a reoccurrence of the symptoms. The best way to prevent an allergic reaction is to avoid your triggers. The hardest part of this is figuring out what that is, because it can be almost anything. Besides pollen and pet dander, other airborne allergens are dust mites, mold, and mildew. Common food allergens are peanuts, tree nuts, wheat, soy, milk, eggs, and bananas. Some medications, like penicillin or other antibiotics, are allergens as well. Besides bee venom, people can be allergic to wasps, latex gloves, or anything else that they come into contact with. Sometimes people can be allergic to more than one thing, which can make it incredibly complicated to figure out what is the cause. In order to find out the reason for your allergies, your doctor is going to ask you a few questions. The first is, do you have a family history of allergies or asthma? And the next is, what type of reaction did you have? They're also going to want you to keep a detailed diary of your symptoms and possible triggers. The best way to know for sure what you're allergic to is to do a skin test or a blood test. Once you know what you're allergic to, do your best to avoid it. Also, wear a medical alert band because this will let rescuers know what you're allergic to if you have a reaction and you're unable to respond. Even after finding out what you're allergic to, still keep a diary because your body can change and sometimes become allergic to a new substance. For pregnant or breastfeeding women, the current recommendation is to maintain a normal diet. The thought is by doing this, it exposes the infant early to the potential allergen, and thereby their body doesn't produce a reaction. Allergies can range from mildly annoying to life-threatening, but the good news is they can be managed, so that way you can lead as healthy of a life as possible. If you have any questions regarding allergies, please speak with your doctor. Thank you for joining me today. I will see you on the next episode.